my name is Iwan. I'm presenting about my internship at Gwinnett Medical, specifically in the Women's Pavilion, which includes the Labor and Delivery Department, NICU, and Mother-Baby. Okay, so I intern twice a week. I intern on Tuesdays and Thursdays from 2 to 5, which ends up being 6 hours a week. I've interned a total of 43 hours. I missed a day due to sickness once. And then a lot of my duties include just doing projects given to me by leaders. So I'll make baby papers, which are include like baby band, side and find the baby, and the birth certificate. And also I answer phone calls. So when the patient is in distress or needing something, they'll call the nurse station. And so I'll pick that up and try to help them as best I can. And if not, I'll get an adult or another nurse to help. And I also make packets for really anyone, including NICU, labor and delivery, so that helps them a lot. And also direct visitors through the department. It's really confusing. There's a lot of different hallways, different rooms, and people get lost very easily, and so I'll have to help direct them through there. Okay, so impact on my future and my employment. Okay, personal outlook. When I first started this internship, I was really strongly set on going and working in the medical field, and it strengthened that. But I wanted to be in labor and delivery, which I've realized is not my calling, even though it's very interesting and there's a lot of different aspects to labor and delivery. I've been there and it's not really something I want to do, but I have been working in the NICU lately, which is very interesting. NICU and includes like the premature babies, the drug babies, and babies that just need more time to grow. And I've made little compartments and set up tables that has all the stuff for the NICU babies, and I've realized I really want to work there. So my plan is to go into nursing school to become a nurse and then work in the NICU for a couple of years and eventually go on to become a nurse practitioner. Okay, so this shows an RN's average salary, just like an idea of where my goals are and what I'll probably be making in the future. So as you can see, I'll start ending up be around here, and then as I get more experience, I'll go on into higher numbers, which will be good. And this shows the projected growth rate. The first graph shows the projected growth rate of industries or places that will hire nurses. So as you can see, hospitals and offices of physicians are projected to continue to grow because there are more people being born at a constant rate and more need for medical attention. And then the last one shows different medical positions that are projected to grow, and specifically I want to point out nurse practitioner because that's the end goal for me. And it's projected to grow by a rate of 34% in the next couple of years. Okay, and experience, I can't talk about specifics really just because of HIPAA laws and the protection there for the patients, but I want to generalize and just say that this has been a really unique experience for me. I've learned a lot, and I've, especially working in the NICU, which I keep talking about because I enjoy so much, I've understood like the fragility of life because there are children there that are 22 weeks old just from gestation and are very young. They're very small. They're like 1 pound, very tiny, and it just made me realize how much I want to help and how much the technology and innovations of this day and age have really impacted the medical world and people's lives. So even though people are born very young at a very fragile age, they are able to live even though they do have mental problems. They're still able to live, which is quite amazing. Okay, there's some stuff that I've learned just from working through this internship. A lot of it's medical stuff, specifically having to do with pregnancy and babies. So the first thing I want to talk about is complications during pregnancy. What I didn't realize is there's this thing that pregnant women can develop, which is called gestational diabetes, which means they have diabetes right up until they have their child. So about a couple hours after they have their child, like 5 hours, the diabetes just disappears. It's just caused by having another life form in your body and having to provide for that life form. And it can cause certain problems with the baby, obviously. The baby can lack nutrition sometimes just because of the diabetes going through the body. And then preeclampsia, it happens after 20 weeks of gestation. It's where the woman has high blood pressure due to the pregnancy, and it can cause problems with the child as well. Okay, complications during birth. This is one of my favorite ones to talk about. It's incorrect fetal position. So when a woman is about to have a baby, the baby will flip, and so their head is facing downwards. So the baby can come out very easily without any problems. And a lot of the times the doctors will grab the head and pull the baby out just to help the woman along. One of a common fetal position that's incorrect is called the breech, where the baby is unable to flip and so is either feet downwards or butt downwards. And so this can cause the baby to lack oxygen because the head will get stuck in between the hips, and because it's no longer connected to the woman through the placenta, they're not receiving nutrients from the woman and oxygen, so it can cause suffocation and things like that. And then also one is the transverse one, right up there. So the baby's laying flat, and the woman's hips will go like this to push the baby out. And when they're in the transverse position, this can cause the baby's spine to snap because they're pushing on the baby. Thank you. Okay, and then certain reasons that the baby needs to go to NICU. One of the main ones is premature birth, so the baby is born early. Babies have been known to survive after just 22 weeks. I've seen a couple babies like that. I've seen them getting their ultrasounds done, which is really cool to watch. And sometimes they'll start their bleeding in their brain back here, which will cause like scar tissue and damage to the brain, but they can still live through that, though they will have mental problems. And then also problems at birth, like I said, including lacking oxygen, which will cause mental delay and sometimes physical delay. And also one of the really sad ones that I've seen lately is when the mother abuses drugs during her pregnancy. So the mother will take drugs, and then the baby will become dependent on those drugs. And then when the baby comes out, immediately after the baby comes out, she'll have to go through withdrawal, which is very traumatic, especially for a newborn. Okay. Oh, my video is not here. But I did have a video up just to show you and give you a little more insight into Gwinnett Medical, because I'm not allowed to take pictures or videos there. It's a very unique place. They're very committed to patient care, and they have a very gorgeous facility, a lot of trees and a lot of places for especially long-term patients to walk around and enjoy their time there. And then, okay, and that is it. Is there any questions?
Any questions? Thank you, Emma.